When Dr. Dorsey arrived at Johns Hopkins a couple of years ago, he reached out to look for assistance in getting his program up and running. He had actually had some experience prior to coming to Hopkins. So my team helped him in identifying some newer technologies, some things that made his workflow a lot easier. And I think so far he's had some great success with it.
All right, Mr. Lynch, how can I help you?
Well, I've got Parkinson, and I'm actually 9 years old, and I'm still...
We just completed a video conference call with a patient in California who's had Parkinson's for the last 5 to 7 years, and he was interested in getting a second opinion on the management of his care.
Dr. Dorsey sends a link with the appointment information. The patient clicks on the link. It starts a video session. It's an encrypted video session, so it meets our HIPAA compliance and whatnot. The session's available just for those few minutes there. The patient must have internet access, speakers, a microphone, and a camera. And then the session happens, and then when it's over, it's over.
Access to care in the United States is often determined by geography. For example, in Maryland, 20 of the 23 counties do not have a Parkinson's disease specialist. So if you live in one of those 20 counties, your only option to receive care from a specialist is to drive or make a long-distance commute to come to Baltimore or the surrounding suburbs to receive care. So we recently completed a randomized controlled trial looking at providing care directly into people's homes via telemedicine to in-person care here in the clinic. And we showed that each telemedicine visit saved patients 3 hours of time in terms of travel and in waiting compared to each telemedicine visit, and it saved them an additional 100 miles of travel. So this is offers tremendous value to patients and really removes a lot of barriers that patients have to receiving care.
As you can imagine, in that scenario with Parkinson's, it's not just the patient, it's also the caregivers and the family members that also are impacted by the patient dealing with the disease. It's something that if we can do it for one, there are other applications which would be very much appropriate to the home: rehabilitation, physical therapy, other types of programs that could also be applicable using the similar kind of setup.